Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning for another segment. We're going to be speaking with returning guest Christoph Denker. He's returning to discuss how Centers of Excellence, or COEs, are increasingly becoming the top strategy for employers to give their employees access to top quality care at the most affordable cost. Welcome back, Christoph. How have you been?
Very well, Neil. Good to be speaking with you again.
Great. Thanks for taking the time with us once again. For those who may not be familiar with you as a contributor, give us a bit of your professional background and talk about your role at Carrum Health.
Yeah, absolutely, Neil. I'm Christoph Denker. I am at Carrum Health. I am responsible for everything related to providers, so finding high-quality and cost-effective providers, bringing them onto our platform. And my professional background has really been in healthcare for the last 15 or even 17 years, working with insurance companies, health systems, and Carrum Health for the last 5 years.
What is a Center of Excellence? What are COEs?
That's a great question, Neil, and many people really define it differently. What it means for Carrum Health is it is a provider that is really, really good when it comes to quality of care, but also really, really good when it comes to appropriateness of care. You know, when you go to a Center of Excellence, you know if they recommend an invasive procedure like a surgery for you, it's really the best thing you can do. There's really nothing else out there that can get you as much of your health back. But then they're also really good in performing those procedures. And then on top of all of that, for Carrum Health, the Center of Excellence really means that it's also a very cost-effective place to have these procedures. And just to give you, a couple of statistics on this, the RAND Corporation, did a study on us a couple of years ago that was peer-reviewed, and they found that, costs are 45% lower when you go to Carrum Center of Excellence, and our surgeons really are in the top 10% nationally.
What entity determines whether or not a hospital is a Center of Excellence?
Yeah, you know what, Neil, interesting, there isn't really a national standard. There isn't a body in the United States that will say, this is a Center of Excellence and gives it a stamp of approval. And so we have to come up with our own definition and our own processes to really qualify these providers. We certainly welcome if there was a more uniform national definition. Unfortunately, there isn't right now.
Now, when it comes to employers giving their employees access to this top quality type of care at an affordable cost, how are Centers of Excellence increasingly becoming the top strategy?
Employers, after 2, probably 3 years of COVID now, they've really been through a lot. And what's happening now with employers is that healthcare costs are really starting to go up quite a bit. Recently, Aon, the benefit consultancy, came up with a projection that employers will have to spend 6.5% more on healthcare. That's a lot. And on top of that, employers are really looking towards a recessionary environment. I don't think they're quite in one yet, but it's certainly, the warning signs are certainly brewing at the horizon. And, if you're an employer and you're seeing a recessionary environment coming up, you're seeing healthcare costs going up quite a bit, then you really ask yourself, oh boy, isn't there something I can do? Isn't there a way that I can deliver great healthcare to my employees and make it also affordable at the same time? And that's really where these Centers of Excellence come in. If you're an employer and you can say, well, I can send my employees to the places where they can get the best care, and I can also make it so that it's cheaper for me to do so, then why wouldn't I? And so that's really the reason why these Centers of Excellence are becoming increasingly important as a benefit strategy for big employers.
Now, I understand that you're already partnering with some top COEs, for example, Memorial Sloan Kettering. Talk about bundles and how they're an integral part of this cost-effective, excellent care.
It's really fascinating that you mention Memorial Sloan Kettering because, they are one of the best, cancer centers in the country and arguably in the world. And that really opens up another discussion point here, which is cancer care. What's been happening over the last couple of years is that for big employers, cancer care has become much more important than it ever has. It used to be that big employers, musculoskeletal care is the number one area of concern. But that has now been overtaken for the first time by cancer care. And so now what you have, employers are saying, gosh, cancer care is the single most pressing issue for me. Costs are going up very fast. The quality of outcomes, Neil, in cancer care unfortunately varies very much, too much in fact. And anybody who's had a family member or themselves suffered from cancer, you really want to go to the best possible care. But not a lot of people actually do. And so that's where centers of excellence really shine. Right? In cancer care, you really want to go to the best of the best places. And from an employer perspective, we also want to make sure that you do so in a cost-effective way. And so centers of excellence clearly fit into any kind of strategy you want to put in place to address cancer care. And Memorial Sloan Kettering was our very first center of excellence when it comes to cancer care. They've been a wonderful partner. In addition to having fantastic quality and fantastic outcomes, one can argue, and there's data to back that up, that if you go there for your care, you have a 20 or 25% higher chance of surviving the cancer. So that's pretty remarkable. And then they said, you know what, we're willing to put our money where our mouth is. And they offered us a payment. And that is something, Neil, that hasn't really existed in cancer care. Cancer care is very much paid as you go. You pay for this surgery, this chemotherapy drug, this radiation session, and the costs add up very quickly. And what Sloan Kettering said, they said, look, we're really good at what we do. We also really know what is the best treatment. We don't just do something for the sake of it. We provide treatment for a patient because it's the best thing for them. And they're so confident that they sat down with us and said, you know what, we are going to offer fixed prices for 2 years of cancer care. And that has never been there before. They said, for example, for breast cancer, this is the price for a patient ahead of time. And they'll even throw in the warranty saying, you know what, if the cancer spreads unexpectedly, that's on us. And so that's just absolutely incredible. And that really, is what we consider a center of excellence. And we launched with them a couple of years ago and have now had patients go to them and rave about the experience. And I think they've really laid down, what it means to be a center of excellence in cancer care.
Now, it's my understanding that Memorial Sloan Kettering provides these bundles that I mentioned earlier that offer diagnosis, treatment planning, chemotherapy, radiation, surgery, all of that in a bundle with zero out-of-pocket cost to the patient. And that does include 2 years of follow-up support after the treatment. Now, is that 2 years of treatment care and then 2 years of follow-up, or is it 2 years inclusive?
Yeah, it's 2 years inclusive. Okay. And the reason we picked it 2 years, Neil, is that, most cancer care really happens in those first 2 years after the diagnosis.
Is there anything that you'd like to add for us, Christoph? And then give us a website where our listeners can learn much more about Carrum Health.
Yeah, Neil, I think what I would like to add is really that, the Center of Excellence model, I think, we've shown it works for musculoskeletal care. It works for cardiovascular care. It works for cancer care. You can really imagine that the sky is almost the limit. Right? If you think about how do you handle healthcare benefits in this inflationary environment, Center of Excellence is really there to help you. And to your question, what else is there to know? We have a lot of resources and information on our website. That's carrumhealth.com. That's CARRUM health.com, where you can read about these various initiatives and centers of excellence that we work with.
Christoph, always a pleasure. Thank you so much for returning. I'm looking forward to our next conversation.
Same here, Neil. Happy Thanksgiving to you and have a good day.
You as well.
Thank you. Bye-bye.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Christoph Denker. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.